Welcome to Loyola. You may be here today for a general eye exam, or you may be here to see one of our many specialists. In addition to our optometrists and general ophthalmologists, we have specialists in the area of the cornea, glaucoma, oculoplastics, neuro-ophthalmology, pediatrics, and the retina. Depending on the reason of your visit, our providers use a wide variety of tests and procedures to examine your eyes. These tests range from measuring the vision by reading the eye chart to the latest technologies that visualize the individual cells within your eye. If you will be having a comprehensive exam today, you may be here 2 hours or more, depending on the number and complexity of tests required to fully evaluate your vision and the health of your eyes. A qualified technician will be doing these tests before you see your doctor. Here are vision tests that you could have during your comprehensive eye exam. The very first test will be a test of how well you see, or a measure of your visual acuity. The most common way to perform this test is to have you read a projected eye chart or a handheld chart for near vision. However, there are many variations and other techniques used to assess vision for those who are unable to read these charts. Every visit will begin with this measurement. This is a screening test performed early in a comprehensive eye exam to rule out color deficiencies. In addition to detecting hereditary color deficiencies, color vision tests also alert your eye doctor to possible eye disease. While there are many ways to check how your eyes work together, the cover test is the simplest and most common. During a cover test, you will be asked to focus on a small object across the room. The doctor will cover each of your eyes while you stare at a target. This test assesses the way your eyes work together. When there is a misalignment of the eyes, we call this a strabismus. When the eyes have difficulty working together, but without a true misalignment, we use the term binocular vision problem. A true misalignment, also known as atropia, can lead to amblyopia or lazy eye in young patients. Binocular vision problems cause one to experience visual strain, fatigue, or blurred vision. Retinoscopy. The room lights will be dimmed and you will be given a large target, usually the big E on the chart, to stare at. As you stare at the E, the provider will shine a light at your eyes and flip lenses in a machine in front of your eyes. Your prescription is determined based on the way the light reflects from your eye. Because the patient does not need to respond, this test is especially useful for those patients who cannot. This procedure is the test most often used when examining children. Your eye technician also may use an autorefractor to automatically determine your prescription. A chin rest stabilizes your head while you typically look at a pinpoint of light or other image. An autorefractor determines the lens power required to accurately focus light on your retina. This is also a test that helps determine your exact eyeglass prescription. During this refraction, a phoropter is placed in front of your eyes and you are shown a series of lens choices. You are then asked which of the two lenses in each choice looks clearer. Based on your answers, the lens power is fine-tuned until reaching a final eyeglass prescription. The refraction determines your level of hyperopia or farsightedness, myopia or nearsightedness, astigmatism and presbyopia. The slit lamp is an instrument that the eye doctor uses to determine the health of your eyes. This lamp, also called a biomicroscope, allows the provider to get a highly magnified view of the structures of your eyes to thoroughly evaluate your eye health and detect any signs of infection or disease. During this test, you will place your chin on the chin rest and your forehead up against a bar. The doctor looks through a set of oculars, much like a microscope in a science lab, and examines each part of your eye. He or she will first examine the structures of the front of your eye, including the lids, cornea, conjunctiva, and iris. With the help of a specialized high-powered lens, he or she will view the inside of your eye, including the retina, optic nerve, and macula. The examination of the back of the eye is most often done under dilation. The glaucoma tests have several variations, all designed to measure the pressure inside your eyes. A glaucoma test is performed with an instrument called an applanation tonometer. The most common of several versions of this instrument is mounted to the slit lamp. For this test, you will have yellow eye drops put in your eye to numb them. Your eyes will feel slightly heavy when the drops start working. This is not the dilating drop. It is a numbing agent combined with a yellow dye that glows under the blue light. Then you will have to stare straight ahead into the slit lamp as the blue light is moved extremely close to your eyes. Applanation tonometry is painless. At most, you may feel the tonometer probe tickle your eyelashes. The entire test takes just a few seconds. You typically have no warning signs of glaucoma until you already have significant vision loss. For this reason, routine eye exams that include tonometry are essential to rule out early signs of glaucoma and protect your eyesight. To obtain a better view of the eye's internal structures, dilating drops are used to enlarge your pupils. Depending on the color of your eyes, your ocular concerns, and the specific drops used, dilating drops will vary in the time of full dilation. Dilating drops usually take about 20 to 30 minutes to start working. When your pupils are dilated, you will be sensitive to light because more light is getting into your eyes. Under specific conditions, you may also have difficulty focusing on near objects. These effects can last for up to several hours, depending on the strength of the drop used. Once the drops have taken effect, your eye doctor will use various instruments to look inside your eyes. You should bring sunglasses with you to your eye exam to minimize the glare and light sensitivity on the way home. If you forgot to bring sunglasses, the staff usually gives you a disposable pair. Pupil dilation is very important to rule out eye disease. In some cases, your eye doctor may want to check for defects or scotomas in your peripheral or side vision by performing a visual field test. Peripheral vision loss is one finding often associated with eye diseases such as glaucoma. Analysis of peripheral vision also may help identify specific areas of brain damage caused by stroke or tumor. You will be seated in front of the OCT machine and you will rest your head on a support to keep it from moving. The equipment will then scan your eye without touching it. This imaging test uses light waves to cross-section pictures of your retina and optic nerve. These measurements help with diagnosis and provide treatment guidance for glaucoma and other retinal diseases. This test is used to map the surface curvature of your cornea, or the outer structure of your eye. During this exam, you will be seated facing a bowl containing an illuminated pattern. This pattern is focused on your cornea and it's reflected back to a digital camera. Your doctor can use the results of this test to plan for cataract surgery, intraocular lens implantation, refractive surgery such as LASIK, or for fitting contact lenses. It is important to understand that a comprehensive eye exam typically does not include a contact lens fitting, and therefore you will not be given a contact lens prescription at the end of a routine eye exam. Contact lenses are medical devices which rest on the surface of the eye and as such require additional measurements for appropriate fitting. At the conclusion of your visit today, you will receive the results of all your tests and a treatment plan will be determined. Please note that our Loyola providers not only see patients at our Maywood campus, but are also available at other Loyola locations, including Burr Ridge, Hickory Hills, Homer Glen, and Oak Brook Terrace. Thank you for choosing Loyola for your eye care needs.